Are you a woman over 40? And is your body suddenly changing and you don't know why? You're not doing anything different, but the weight just won't budge, or your sleep is off, and your emotions feel like a roller coaster. If you're over 40, there's a good chance menopause is behind it. So today we're talking about what's really happening in your body and what you can do to start to feel like yourself again. Menopause is inevitable for us women, but suffering is not. So, this is episode number 196, Menopause and Metabolism, what every woman over 40 needs to know. This is the Healthy Real Food Podcast. I'm your coach, Erin Hart, a registered nurse and health coach who understands the struggle of feeling out of control around food and has walked the path of transformation, experiencing the miracle of sustainable weight loss with the sugar and flour-free lifestyle. If you are a woman who feels powerless against your cravings and is ready to live your life with more energy, mental clarity, and purpose, there is hope. Here we believe that with God, a mindset of unstoppability, and consistent execution of a winning strategy, anything is possible for you. So if you're ready to find freedom from food addiction, take control of your health, and pursue your dreams with renewed energy, support, and accountability, let's go. Hey, my friend, welcome back to the Healthy Real Food Podcast. I'm Erin Hart, and I'm so glad that you're here because today's episode is one that every woman over 40 needs to hear. We're talking about menopause, but not just the symptoms of menopause. We're going to dive deep into the science of what's happening in your body, why weight gain, fatigue, and mood shifts happen, and what you can do about it. This episode is grounded on research and insights from experts like Dr. Mary Claire Haver and Dr. Sharon Malone, and it's designed to educate and empower you to take charge of this next phase of your life, because if you're a woman, there's no way around it. But let's make going through menopause easier. So first, what actually is menopause? Let's talk about the science. A woman is born with all the eggs that she will ever have, typically around 1 to 2 million eggs at birth. And by puberty, that number drops to about 300 to 400,000. And only about 400 to 500 eggs will ever be ovulated in a lifetime. Throughout your reproductive years, your ovaries release an egg every month and produce hormones like estrogen and progesterone. These hormones regulate your cycle, support fertility, protect your bones, heart, brain, and skin, and influence metabolism, mood, and much more. So as you enter your late 30s and early 40s, your egg supply, called your ovarian reserve, begins to decline significantly. Your body becomes less efficient at producing balanced hormones and eventually stops ovulating altogether. So the definition of menopause is 12 months without having a period. But 7 to 10 years before that, before you completely stop, is perimenopause, when estrogen and progesterone begin to fluctuate wildly. And that's when those symptoms begin. When estrogen and progesterone drop, it affects your body. Your metabolism slows down, and without any changes in the way that you eat, your body composition shifts. Estrogen plays a really critical role in regulating insulin, muscle maintenance, and fat distribution. So without any change in your diet, you lose lean muscle mass, which lowers your resting metabolism, and you begin to store more visceral fat, which is the fat that's around your organs, around your midsection. So visceral fat is the harmful kind of fat around your organs that increases the risk of heart disease, type 2 diabetes, and inflammation. When estrogen and progesterone drops during perimenopause, bone loss also accelerates. Estrogen protects your bone density, After menopause, women can lose up to 20% of their bone mass within the first 5 to 7 years. This increases the risk of osteoporosis and fractures, especially in the hips, spine, and wrists. Perimenopause also can result in cognitive and mood changes. Estrogen acts like a neuroprotective hormone. Estrogen helps to maintain the plasticity in between the synapses of your neurons, which means how well your brain cells communicate with each other. And when the estrogen drops, many women experience brain fog, forgetfulness, anxiety, and mood swings. Does that sound familiar? And your risk of cardiovascular disease also increases with these changes in hormones. Estrogen helps keep your blood vessels flexible and supports cholesterol levels. After menopause, LDL, the bad cholesterol, often rises, and HDL, the good cholesterol, can drop, increasing your risk of heart disease, which is the number one killer of women. You may also experience vaginal and urogenital changes. That drop in estrogen causes vaginal thinning, dryness, and decreased elasticity, which can lead to pain with sex, urinary tract infections, or incontinence. And these issues are rarely talked about, but they're so common in women and they're very treatable. And I'm not a doctor, I'm a registered nurse. I don't give medical advice outside the hospital. But I want to empower you with this knowledge so that you can talk to your medical provider for treatments to help you to manage this so you don't have to suffer, to make it easier for you to go through this. Especially for women who are trying to lose weight with a sugar and flour-free lifestyle, the women that I coach, I think it's really important to take into account our hormones and recognize symptoms of perimenopause and menopause. So here are the most common signs that your hormones are shifting. You might have hot flashes and night sweats. We all hear about that, right? Irregular or heavy periods, weight gain, especially around the belly, mood swings, anxiety, depression, just not feeling like yourself, trouble sleeping or staying asleep, fatigue or low motivation, brain fog, forgetfulness, vaginal dryness, pain with intercourse, decreased libido, hair thinning, or dry skin. So many women are just told that this is just aging, but no, that's really not true. These are hormonal changes and they are treatable. Before we talk about how to support your body with hormone replacement, which is an option for some people, and that can be a great option for people who are around the age of perimenopause or menopause. Let's cover the foundational health pillars that every woman needs, whether or not she chooses hormones as a treatment modality. So the first one is just sleep, right? We want to focus on our sleep. Menopause really disrupts our circadian rhythms. And so practicing consistent bedtime routines, limiting blue light, and keeping your room cool and dark is so important. Magnesium, breath work, and low cortisol evening routines can really help calm your nervous system before bedtime. Secondly, a natural way to support your body during this transition with your hormones is your diet. So prioritizing lean protein, aiming for optimizing your protein to prevent muscle loss. It's so important to maintain or build muscle during this time because naturally what's going to happen as you have these changes in your hormones is that you lose muscle. And muscle is the organ of longevity. So we want to do all that we can to preserve our muscle mass and prevent muscle loss. So focusing on fiber-rich vegetables, healthy fats also is important to balance your blood sugar and support estrogen detox. Avoiding sugar, flour, and processed carbohydrates, they really worsen inflammation and contribute to weight gain. So we want to do all that's within our power with sleep, diet, and then thirdly, exercise. So exercise is so important during this period of perimenopause and menopause, postmenopause. Strength training is just non-negotiable. If you are a woman over 40, you need to strength train to maintain your muscle mass, to boost your metabolism, and to fortify your bone density. And low intensity movements like walking, stretching, or yoga are also great, but use cardio sparingly. You don't need to do heavy cardio. Too much cardio can really spike your cortisol, especially during perimenopause. So focus on the strength training and just joyful movement, whatever you enjoy doing. So according to Dr. Mary Claire Haver and Dr. Sharon Malone, when you are in this window of opportunity, meaning like you are a woman over 40, typically before age 60 or within 10 years of menopause, there's an opportunity for you to replace your hormones with hormone replacement therapy. And it can help reduce your hot flashes, night sweats, and mood swings, improve sleep, libido, vaginal health, protect bone density, support muscle retention and fat loss, lower the risk of your cardiovascular disease by almost 50%, and may reduce long-term risks of dementia. Hormone replacement therapy, back in 2002, there was some misinformation put out that hormone replacement therapy causes cancer or lead to increased risk of breast cancer. And that study was really put out wrong. That was not the truth for the majority of women. For women who are within this window of opportunity in the perimenopause and postmenopause years close to menopause, hormone replacement therapy is now known to have many benefits, and the risks are very low. There are different types of hormone replacement therapy. Estrogen only, so that's for women who do not have a uterus. But if you do have a uterus, you need to combine estrogen and progesterone that will help protect the endometrium. Bioidentical hormone they're identical in structure to your body's natural hormones. And there's different delivery methods of these hormones, like patches, gels, creams, pills, or vaginal rings, inserts. There are some risks to hormone replacement therapy, like with any risk. And that's something that you'll want to talk to your doctor about. But the risks are really minimal, and the benefits far outweigh the risks in many cases. The biggest risk, from what I understand, is for women who are past that window of opportunity. So if you're like over 60, you've been past menopause for more than 10 years, you want to just make sure before you start any hormone replacement therapy that you have a healthy heart and cardiovascular system. You don't want to start taking hormones if you have atherosclerosis. That can lead to issues. But if that's not you, there are very few risks associated with it. There may be a slight increased risk of breast cancer with long-term use of certain types of synthetic progestin, but talk to your doctor about it. The big study where they came out in the hotel and they said, this is like hormone replacement therapy causes cancer. It was really done wrong. The people that they studied were over 60 years old. They were way past menopause. They were outside of this window of opportunity. And the increased risk of breast cancer, it was so minimal. It was like, instead of 5 out of 1,000 people, it went up to 6 out of 1,000 people or something like that. If you have any risk of blood clots, if you are someone who has a clotting disorder, you want to be careful primarily with oral estrogen. But the other forms of estrogen really don't have that same effect with the risk of blood clots. You should also use caution if you already have cancer, a hormone sensitive cancer. Those are things that your doctor would want to take into account. The key is personalized care. Just make sure that you're getting the right type, dose, and method for your unique body and situation. And a medical provider can help walk you through that. So, where do you get help? If you are suffering from symptoms of perimenopause, you don't have to be. There is a treatment and it's very low risk, and the benefits far outweigh the risk. Like I said before, the benefits of hormone replacement therapy, it helps to strengthen your bones as you age. It reduces the risk of cardiovascular disease by almost 50% or around 50%. And also just helping you to feel better, to feel like yourself, to feel good, and to help support muscle retention and fat loss, reducing the risk of dementia. There's just so many benefits to doing this that it's something to look into and to educate yourself about. So here's how to start the process. First, you start tracking your symptoms for a few weeks, and then ask your doctor for a hormone panel. But remember, treatment is based on symptoms, not just on your labs, because the labs in perimenopause fluctuate so much. They really treat based off of symptoms, so not just labs. Find a provider who is certified through the Menopause Society or trained in functional medicine or bioidentical hormone therapy, and ask about transdermal estrogen and micronized progesterone, which have the best safety profile. Menopause is not a decline, it's just a biological shift. And with the right support, it can be the beginning of a vibrant, powerful new chapter. A lot of women say that it's really hard to lose weight after the age of 40. But the thing with the sugar and flour-free lifestyle that they've found is that women over 40 compared to women before 40, perimenopause and postmenopause, they all can have success with a sugar and flour-free lifestyle. It's effective for you no matter where you are on that spectrum. And you deserve to feel strong, clear, and at home in your body again. So if you are looking for support in helping you to feel your best, if you want to lose weight for the last time, I can help you. Be sure to visit my website at www.healthyrealfood.com and check in with your medical provider and ask them about hormone replacement therapy and if it's right for you. So I hope you guys have a wonderful week, and we'll talk to you next time. Bye.
Thanks for listening today. If you enjoyed this podcast, you're going to love my coaching program. If you're struggling with your sugar and flour-free lifestyle and want to lose weight for the last time, I can help you. I guarantee that you achieve your goal body within a year, or I will coach you for free until you do. Just imagine living in your goal body and having peace with food. Your success is guaranteed. To learn more about how to get support, guidance, and accountability so you can find peace with food, achieve your goal body this year, and have more energy, visit www.healthyrealfood.com. While you're there, be sure to sign up for the upcoming free challenge to learn the success framework, and click the link to my schedule for a free 30-minute one-to-one coaching call so we can get you started on your success path. You have the power to create the life that you want. This is the year of you. I'm cheering you on. Now go win the day. You got this.